Okay, hi Whitney, this is LaDonna, and I am answering some of your questions for your school project. So I'm going to refer over here to your questions. And your first question is, describe your career as a pediatrician as it pertains to treating eczema. So as it pertains to treating eczema, as a pediatrician, I am usually the first line in general for someone who has a skin problem. Usually you see a pediatrician before you would see a dermatologist. Now keep in mind, I'm not the type of pediatrician that sees patients in the office anymore. I see patients in the hospital setting. So for me specifically, with the type of medicine that I practice, it's usually kids who are fairly affected by eczema, like it's been infected or it's the rash is really bad. Generally speaking, I do like the first line of treatment, and if things go well, then their pediatrician on the outside would continue to manage it. If things don't go well, then they would be seen by a specialist for skin called a dermatologist. Your next question is, what education level is needed to pursue a job in your field? So in order to pursue a job as a pediatrician, specifically pediatric hospitalist, which is what I am, you would need high school, of course, and then undergrad and medical school degree. Currently, pediatric hospital medicine does not require a fellowship, but some places have started fellowship training, which means that after residency, pediatric residency, you would also have to do a fellowship in hospital medicine. Average salary for a pediatrician varies based on the area of the country and also on if they are specialists. So that's kind of a difficult question to answer. Specifically for my area of pediatric hospital medicine, it's a pretty new field, like less than 10 years of age. So averages fluctuate quite widely over the country. So I can't really answer that question all that well. And then the last thing is interesting information about pediatrics or eczema. So since your project is about eczema, I will say that the most interesting thing about eczema is that it's a rash that comes about because of an itch. So generally speaking, somebody starts off with the itch, they scratch, and then the rash comes. So if you can keep from itching, you can keep from having the rash of eczema. And the best way to keep from itching is to keep the skin well hydrated. One way to hydrate the skin is with water, surprisingly. So taking baths, not too long, but long enough to hydrate the one of the layers under the skin that absorbs water. And then also by keeping that moisture in by using like thick moisturizers like Eucerin and Aquaphor and shea butter and all those thick creamy things. So I think those are pretty interesting facts about eczema. If you have any other questions, let me know. Bye.